Hi, Andy.
Hi, Victoria.
Today we have one of our graduates, Dr. Sanjiv Lakhia, who is a physiatrist, and he's going to be talking with us about what to do about back pain.
Well, I don't think there could be any more relevant topic. So many people are in terrible distress as a result of back pain.
It's so true. Let's get him on.
Okay.
Dr. Sanjiv Lakhia is a double board certified physiatrist and integrative medicine physician who specializes in non-surgical approaches to spine and orthopedic conditions. He believes that healing goes beyond treating symptoms and is about restoring health, resilience, and quality of life. Dr. Lakhia is a graduate of our center's Integrative Medicine Fellowship and author and a podcast host. Welcome, Sanjiv.
Thank you so much, Victoria, for having me. It's an honor.
We're delighted to have you. And we'd like to begin with this basic question, which is, why is it that so many people with back pain end up without a real diagnosis? We say they have non-specific back pain.
Well, that's the number one question that faces all the clinicians in the country about back pain. The short answer is back pain is multifactorial, it's complex, meaning there's many reasons your back can hurt. And the traditional medical model, which is somewhat of a reductionist model, really looks just at the structure, imaging, x-rays, and that doesn't always tell the full story. So if you go to see a clinician and they can't 100% point to a structural issue on an imaging study, you will get a label of a non-specific back pain. But boy, there's so much more, and I'm looking forward to talking about that.
Yeah, well, back pain, as we all know, is insanely common. I mean, the NIH says that 8 out of 10 people will have back pain at some point in their lives. So what do you think puts us at such high risk of having back pain?
I was thinking about that just a little bit ago about why are we in this situation in the United States and then across the world where, like you said, it's one of the top 3 causes of disability and work-related time off and lost production. And I think you could start answering that at multiple levels. Foundationally, I don't think we understand in this society the fundamental importance of posture and breathing. And if you look historically at other nations, other cultures, that sort of knowledge and information is ingrained within the culture and the upbringing. And it's not in the United States. And I really hope one day we can get to a point where we're having deeper discussions about preventative strategies for back pain, where we're pushing in proper knowledge and information into the school systems. Like there should be a class on it in high school about the basics of posture, about breath work, and strategies that you can take at an early age to protect your spine and help it last your whole life.
Andy, you and I have a colleague and a friend whose mother was always telling her, sit up straight.
Yep. Well, I would say going back even before what Sanji was saying, I think walking upright is a relatively recent evolutionary advance. And I think we haven't quite worked out all the difficulties of that. I think that just is a stressful posture for humans. And I think it puts us at risk for back pain.
That's interesting. One of the things that I learned, and I'm just full disclosure going to say that I wrestled with back pain. My back pain was actually thoracic, not low back, for about 10 years. And one of the things that really helped me was walking backwards, which was something that I learned from a posture leader. Her name is Esther Gokhale. And she says when you walk backwards, you naturally realign and you actually lift your pelvic floor muscles. And of course, then when you right yourself and walk forward, after a little bit, you lose it. But it's a really easy way, in my experience, of realigning and having good walking posture. And of course, there's walking posture, there's sitting posture, there's laying down posture.
I interviewed multiple people on this topic. And just as some background, I work in one of the country's largest private neurosurgical practices. So we are kind of the endpoint for a lot of people. And I really went on a deep dive in terms of how we got in this mess. I had a chance to interview Eric Goodman, who created foundation training, and I've gotten to know Dr. Stuart McGill, who's internationally renowned for his approach to rehab of the spine. And one of the unifying themes, and just to keep it simple, folks, is that we work the muscles in the front of our body way too much than the ones in the back of our body. And we lose the symmetry and the muscle balance. So what she's talking about there, walking backwards, quite simply, you're activating the glute muscles, the hamstrings, the calf muscles, the erector spinae, and the upper trapezius muscles. And this is what's called the posterior kinetic chain. And it needs some love. Our day-to-day society, where we're sitting like you and I are doing right now at a computer, leads to tightness in the scalenes, tightness of the psoas muscles, which are the muscles that lift your hips up, tightness in your abs, and it leads to what we call gluteal amnesia, where your butt muscles fall asleep. So any sort of lifestyle that promotes activating the posterior kinetic chain, any sort of fitness program that does that is going to serve you well. I think that's part of what you dialed into. And I wish I had learned this when I was younger. And in full disclosure, and I'm not, I thought about, am I going to share this because I'm an expert in back care? But, God has blessed me with both professional experience and personal knowledge, whether I wanted it or not. And I'm sitting here 12 weeks removed from a lumbar microdisc surgery for pain going down my leg. And I write about it in my book. I've talked about it in my podcast. A lot of what I've learned, I share with my patients. It is a journey, and there's lots of tools. And I write about it in my book. I put this out at the end of last year, Healing Pain Pyramid. And Andy, I tried to build off of your idea of the food pyramid. I like pyramids. They make sense, right? The base of the pyramid is the foundational, it's what's most important. And then you go from there. But what are tools and strategies that people can use to help themselves without having to go see a physician all the time and kind of reclaim their health and their spine care?
Sanjiv, I have been and continue to be a great believer in John Sarno's philosophy. I knew him. I think he was brilliant. And as he taught that the vast majority of back pain is what he called tension myositis syndrome, which originates in the mind. And that has been my experience as well. And, he often told patients to ignore what was going on in the back. He discouraged people from doing interventions directed to the back. And I've known patients that had brilliant results just from listening to him or reading his book.
That's why level 1 of the pyramid in my book is titled Mind Your Thoughts.
Mm-hmm.
So Sarno's work is pioneering, and I got to interview David Schechter, who's a pupil of his, who carried the torch. And I was just really trying to understand what's the connection. And it's really in the science, in the literature. Now we can look at people and I can say stress has a direct correlation on inflammation. Mm-hmm. We know you can measure cortisol levels, cytokine levels, inflammatory markers in your body that correlate with your emotional state. And when I say that to people, it kind of shifts the conversation from, oh, he thinks it's just in my head, he's being dismissive, to, oh, this is real.
Yeah.
So one of kind of the phrases I like to tell my patients is mind your chatter, or over chatter. Right? It's important to self-talk. It really, really is. I will find myself saying oftentimes throughout my day when I'm having some symptoms, physical activity is safe and healthy for me. And I'll just repeat that. It's a little bit of a mantra. You could call it a mantra. I have an Eastern background, so mantras have a lot of spiritual meaning. But I really think of it as just programming my psyche and dialing down the limbic system, the emotional center in my brain. And I think Sarno was onto that from the beginning. Now, I would push back just a little bit. I don't think every spine issue is something that you can conquer with that approach. Obviously, there's neurologic issues that can develop that need attention. But boy, it's a great starting point for most people. So I spend probably the most amount of time talking about those types of strategies in my book.
And Sarno pointed out, and I think the evidence is overwhelming that this is true, that there is a very low correlation between structural findings as shown on imaging studies and symptoms, that you can look at x-rays and scans of people that look so awful you can't imagine that they could move or stand and they have no pain at all, and others that look fine and are crippled by pain.
It is unbelievably true. And, we took the oath, do no harm. I would submit that as physicians, we are doing harm by over-ordering imaging tests when they're not indicated.
And also the interventions that follow from that. I've known so many people who've had back surgeries and that probably were not necessary and maybe did more harm than good.
That's correct. But, if you're a hammer the person's a nail. And if
Yep.
that's all the tools you have in your toolbox. But coming back to the imaging, I want to point this out to people. When you go to see a physician, we have certain criteria we look for that would indicate or the need for something like an X-ray and MRI. And if we say it's not indicated, it's not because we don't care. It's because we know, like you just said, Andy, that oftentimes these tests can pull up findings that aren't relevant. But once you see it, it's like, oh my gosh, I got a degenerative disc. Oh my gosh, I've got a bone spur. It's part of your story.
Yep.
So I don't want to add to your story in a negative way, or at least in a way that's not going to lead us down a path to healing. So that is, I will absolutely, I just saw this morning. I had a patient today. I pulled up her MRI. She had severe pinching of the nerve on the right at L4-5. And I came in the room and I said, so how's that pain in your right leg? And she's like, oh, it's my left leg. So I said, well, great. We don't need to talk too much more about this. There's nothing dangerous on it. Let's explore what's going on. So it happens every day.
Mm-hmm.
You both brought up Sarno, and one of the things that I don't know how aware our listeners are is this concept of central sensitization, which is really the way in which the brain, with its wonderful neuroplasticity, but in this case, not so wonderful, magnifies that story, that experience of pain. Of course, all pain comes from the brain. People who have had an amputation can still have pain in a limb that no longer exists. It's our brains are the pain signaling devices. And if the brain becomes more sensitive with this central sensitization, then smaller and smaller stimuli, a breeze, someone touching you gently on the shoulder can generate very significant pain. So, one, what part of your practice is central sensitization, Sanjiv? This can happen pretty fast. Once someone's been in pain for a few months, they could have it. And what do you do about it?
Well, I'll put it this way. I would say if I see 3,000 encounters in a year, maybe 10 or 20% of those are acute presentations of recent conditions.
Mm-hmm.
The rest fall in the chronic pain bucket that on some level have sensitization going on. So you have to approach it, though, delicately. And speaking of someone who's dealt with issues, when you got pain into your leg and foot, having someone say, well, it's just in your brain, that's kind of frustrating and it's non-validating. So I think you have to talk to a practitioner who, number one, honors where you are as a patient. Then you can transition into, all right, look, here's how we're going to approach it. Everyone can understand if they're trying to be healthy and develop a fitness program, they're not just going to do one thing. They're not just going to run, right? We want to do cardio. We want to do some resistance training. We want to do mobility work. Similarly, to help you recover, we're going to address multiple areas. I'm not just going to address your back. I'm not just going to address your leg and foot. Let's talk about the main communication centers in the brain and what are some strategies that we can implement to dial down that excitability in the central nervous system. Your computer's on overload. It's oversensitized. And that's where I talk about things that sound silly, but I think they're highly effective. How much time are you spending in nature? Have you considered doing any meditation or breath work? What are your friendships like? What appeals to you that just generally makes you feel good? I think there are some general strategies that are very, very free, but then there are also strategies that involve tech. Like you can look at a device such as the Alpha Stim unit. Mm-hmm. If you're not familiar with it, the Alpha Stim unit, it has what's called cranial electrical stimulation. It sends low frequency waves through the earlobes via the cranial nerve canal to centers in the brain that are responsible for coordinating what I call the discussions surrounding pain in your body. Mm. And let's jump in there with some positive energy to kind of reframe that discussion. So there are many different tools, tapping. I mean, a lot of stuff we learned in the fellowship, I think, can be extremely helpful. It's just, for me, it's about what appeals to the person in front of me. Because if it makes great sense to me and I think it's got amazing science behind it, it's the greatest. But if it doesn't work for the person in front of me, then what am I doing? I'm just pushing on my own personal views. But it is something that we talk about quite often in the practice. If you simply ask two questions, this can be a pathway into dealing with central sensitization. What do you need to let go of? And how can you create some space in your life?
Mm.
Because those two questions can lead to the triggers that perpetuate the sensitization process of basically being on overdrive. And I ask those a lot and I shut up.
Andy, you, I think, are one of the people who brought mind-body medicine into the culture of medicine. And what Sanjiv brought up earlier, which is someone hearing, oh, that doctor thinks it's just in my mind. How do you manage that?
Well, I think there's an art in how you put that because patients are so ready to feel that they're being accused of having imaginary symptoms.
Mhm.
And one suggestion I made is that we don't use the word psychosomatic and instead use
Mhm.
somatopsychic because psychosomatic has such a wrong connotation.
Mhm.
So I try to explain to people that the mind and body are connected. And it's not that the what you're experiencing in your body does not exist. It's that there's a connection there that you can take advantage of to put healing energy in. So I think it's a matter of the words you use and how you express that.
Sanjiv, do you have any other strategies besides what you've already brought to the conversation?
In terms of addressing central pain or,
No, the mind, body, and people hearing when
yeah.
you say to them, I want to work with your whole system, them hearing, oh, another doctor who's dismissing my pain.
Yes, I bring up two very, very common experiences for a lot of people.
Mhm.
Number one, almost everyone can relate to butterflies when they have to give a public talk.
Uh-huh.
And then I walk them through that. Like, have you ever had to speak in front of a group and you feel a little queasy in your stomach? Well, that's literally your emotions, your slight anxiety triggering peristalsis or increased gut motility.
Mhm.
That's a perfect example of how our emotions influence our physiology. If
Mhm.
they don't get that one, they definitely get this one. Have you ever had a disagreement with your spouse? Has it triggered a migraine or a headache? Does it make you tense in the jaw, neck, and shoulders? You can't take a deep breath? Again, emotions lead the physiology. And once you can kind of find an example that someone can relate to, they're in. All right, well, what do I do? How can I do this? And then I just like to explore what's their capacity? What can they do? Maybe right now, all they can do is Andy's popular 4-7-8 breath. I literally have them count for me. Well, how many seconds does that take?
Mhm.
They do the math 4 plus 7 plus 8. It's like 19 seconds. So everyone has time for that. And if we do that a few times, how about the next time you are at your doctor's office and they're running behind? Not me, I don't run behind. You knock out 5 cycles of 4-7-8. I did 4-7-8 before I came on this podcast because I was very nervous, excited, and honored to be here, and it calms me down.
Yeah.
So you got to find where people are. Meditation is very interesting. Andy, I'd love to get your thoughts on this. It used to have, given its roots in India and China, Eastern roots,
Mhm.
a little bit of a mystical connotation. And living in a largely Judeo-Christian society, not the language that people speak of. So when I've talked to people, I frame it a little bit differently now. What I have found, my pathway into meditation for people can be something like guided imagery. It can be breath work versus Tibetan
Yeah.
meditation or pranayama, alternate nostril breathing with Kapalabhati. Like speaking the language, because I work predominantly in Charlotte, North Carolina, and Rock Hill, South Carolina.
Mhm.
We're talking about meat and potato folks, salt of the earth people, blue collar workers. They come in, their clothes are a little dirty. They've been working their tail off all day, and I'm not going to get them to sit in a lotus posture
Mhm.
and meditate on their chakras. So it's really an art. And I learned some of this in the fellowship about with the motivational interviewing and really we can have the best ideas, but connecting with people is so important.
That's very wise. I try to explain meditation as nothing other than focused attention.
Yeah.
Yes, that keeps it
I'd
simple.
love to switch gears a little bit because one of the things you are expert in, Sanjeev, beyond how to help people think much more broadly, is some of the newer technologies and procedures for helping. And indeed, you mentioned earlier that you had one. So, what role do you think that spinal injections play when someone has chronic back pain, and when are they most appropriate?
I mean, they are a lifesaver, right? So I'm so glad I'm an integrative physician, which means I take the best approaches from multiple domains
Mhm.
as informed well by the medical evidence, and I offer it. Epidural steroid injections are absolutely a godsend for people with acute inflammatory pain going down their leg or down their arm from stenosis, or let's just call it a pinched nerve.
Mhm.
They are not a solution, they're a bridge, they're a lifeline. I essentially frame it this way. Look, pain relief is good. Okay. We can talk all we want about, I want you to improve your diet, meditate, walk, all those things, but we need relief. People need relief so they can function. So we're going to utilize the injection. We're going to calm down your symptoms. It will allow you then to unlock the tools that you need to implement in your life to have sustained, durable success. Physical therapy, walking program. I mean, you cannot absolutely start a new food plan if you don't have the energy because you're dealing with 7 out of 10 inflammatory pain in your leg. It's just unfair to ask someone to do that. The order of operations is so critical when people come to see me and they're suffering. I really look right up front, what can I use from my traditional tool bag to help people feel better, whether it's prescription meds, epidural steroid injections, acupuncture, which I think is kind of has one foot in both sides now with the advances with electroacupuncture, battlefield acupuncture. Like, I need to get buy-in because if I can't get some relief, they're not going to follow anything else I have to say moving forward that I know needs to be put into play long-term for them. So yeah, the steroid injections for acute pain, if you're out there, if you've been suffering for, let's say, 3 months or less with very specific pain and a certain distribution, certainly talk to your physician about that.
Do you have any experience with red light therapy, which some friends have been telling me has helped them?
Yes. In fact, I have utilized red light therapy as part of my post-surgical recovery. So for people who aren't familiar, there's a lot of research and data, at least scientific data. I would not say there's large-scale human data on this, that there are certain wavelengths of energy that stimulate the production of what's called our mitochondria. And we generally refer to mitochondria as the energy factories of the cells. And it's really kind of the root cause cellular dysfunction of almost, in my opinion, almost every health condition. So red light therapy, and just if you're wondering how that works, you can lay in a bed like a tanning bed, which I did. You can purchase a lamp. You can use a wand. Stimulates mitochondrial growth and synthesis. It improves blood flow and circulation to the area. It helps with the remodeling process for scar tissue post-surgical. I mean, I believe in it so much that our group is in the process of purchasing one to offer it to our patients. And this is like a mini house mortgage to buy a professional quality one. But I've used it as part of my protocol. For me personally, I felt like it boosted my energy. I felt like it helped reduce just some of the general soreness in my body and has been a part of my recovery process. You know, it takes a village to get better when you have pain. We talked earlier, Andy, that words matter. I hate the phrase biohack. Okay. Like, do people know what hacking is? Hackers sit at home illegally infiltrating our computer systems to obtain data and use it in a nefarious way. They're breaking in. So when I hear someone say, I want to biohack my body, I'm thinking, so you want to forcefully break into your physiologic system and create havoc and create a system that doesn't exist. But I do like the term biostack. So red light therapy could be part of your biostack.
Great. That's very, very helpful.
Along the line of questioning, what about the new minimally invasive surgeries for the spine? Obviously, when people have had back surgery in the past, sometimes it was very invasive and you ended up with a fused spine, but now we have much more, I'm just going to use the word delicate or refined kind of surgical options. What role do those play?
That's a great question. I just had that. That's what I underwent 12 weeks ago. Minimally invasive spine surgery speaks to the concept that less tissue damage during the surgery leads to a quicker recovery, right? It's just common sense. That's what everyone wants.
Right.
It's been around in general surgery for a long time with laparoscopic procedures. And in the back, minimally invasive spine surgery, the condition that's right for that is what we term a single level, or just so people can understand, let's say one disc that is herniated or is pushing on one nerve,
Mhm.
and you're getting pain in a predictable pattern from that pathology. Those are the situations where seeking a neurosurgeon who's skilled in minimally invasive technique would make a lot of sense. And the way it works is they essentially use tools that are moving tissue aside gently versus cutting through it
Mhm.
to get to the targeted tissue. But make no mistake, Victoria, it is surgery. So for example, to get to the nerve root that I was struggling with, my surgeon, who's amazing, he did have to remove a thumbnail size amount of bone.
Mhm.
And then he goes in and clips a little bit of disc out of there and just gently moves the nerve and lets it sit back.
Mhm.
But, you know, cosmetically, it's great. The incision is very perceptible. The muscular component of post-surgical back pain is far less than large incisions. But I would leave you with this on minimally invasive surgery. And my colleague and friend, Dr. Mark Smith, who did my procedure and is the president of our group, I interviewed him on our podcast, and he told me something that kind of resonates with me, and I share with patients. Minimally invasive is not successful if it's minimally effective. Me- meaning, meaning at the end of the day,
Yeah.
you need to do what the patient needs.
Right.
And I have seen patients, because of fear of traditional surgery, push for a less invasive surgery to their own detriment.
Mhm.
Because what you don't want is surgery number 2 or 3,
Right.
right? So if the surgeon cannot create a field of view that's enough for them to identify what they need to do, then they may not be able to do a less invasive procedure.
Yeah. Well, that's certainly very important to be aware of. Maybe one last question, and that would be, are there any exercises that, from a public health perspective, you haven't examined our listeners,
Yeah.
but you'd say these are the really effective prevention exercises? We talked a little earlier about the posterior chain of muscles and about walking backwards, but what would you say would be the things that if everyone did, we'd see a lot less back pain?
Well, it's interesting, Andy, you mentioned earlier on about the evolutionary adaptation to walking. What I find in my experience, the issue in our society is the sitting, and walking can be a remedy. It's a little bit of lubricant for the discs and joints. So, as with anything, proper posture and technique. But all right, if you have to pin me down, here's a couple for people to explore, and they might want to do this under the guidance of a therapist. But, you know, and I'm going to steal some of this from Dr. Stu McGill, who's really the expert on some of this. Bird dogs,
Mhm.
pelvic bridges, and side planks,
Okay.
to me, are 3 essential must-haves. Unless you're a farmer or you're Amish, but if you're like the rest of us that are sitting at computers all day, doing these in the evening or in the morning, whenever you can, are critical. I would stack that with some walking.
Mhm.
And the other kind of tip I would say for people who have back issues is that less is more. And what I mean by that is you don't have to do a robust 90-minute workout to obtain benefits.
Mhm.
So it's just like a prescription drug, Victoria. The dose matters. You can do let's say we could write a prescription for 5 minutes, 3 times a day of walking. We could do 10 pelvic bridges twice a day, and we can do 5 bird dogs twice a day. Like, it's not a lot,
Mhm.
but less is more. You stack these micro wins on your physiology, and then your body starts to adapt positively.
Mm.
The other thing I would say, I'm going to put a plug in for my friend Eric Goodman, foundation training. If you haven't explored it, you definitely should look it up. It's a whole system designed around the posterior kinetic chain. It's almost like a hybrid of yoga and Pilates. Yoga, and I grew up, my dad, who's 80, is a authentic yogi. He he's had back issues, but he continues to teach yoga to this day. And I've had discussions with him about yoga. Yoga has a deep flexion-based component to it, so deep bending component, which for a lot of people is problematic. Foundation training, if you have even the slightest inkling of back discomfort, might be a better system to pursue and explore. It can be a 5-minute routine of exercises, and he's got terrific information on his website, examples of that as well.
That was awesome. I think
Yeah.
you gave a lot of tips for people to explore. And Sanjiv, I want to thank you so very much for coming on the podcast and for sharing your wisdom and your experience with Body of Wonder listeners. Thank you.